I want to turn to Ed Haislmaier. He's a senior research fellow in health policy studies at the Heritage Foundation, a conservative think tank. Ed, in March, you wrote this: the key problem with the draft House health care bill is that it fails to correct the features of Obamacare that drove up health insurance costs. So where do we stand now? Does it correct that?
Well, that was what this amendment, the MacArthur amendment, does, is it allows the states to address those through a waiver process. Not ideal, but it certainly was enough to, as you can see, move the bill towards passage, and it can go to the Senate now. I mean, this is a process where Congress and the administration need to make good on their pledge to give people relief from the things that have driven up the costs and decreased the access to health care for people who aren't getting subsidies under the ACA or Obamacare.
But without having those numbers from the Congressional Budget Office, how does anyone know whether or not this plan will in fact do that?
Well, yeah, we have the Congressional Budget Office is the official scorekeeper, but there's lots of people on the outside, ourselves included, who can analyze this and look at what the numbers are. And we're looking at a situation where you could reduce premiums substantially in a number of states if you had a state could take a waiver under this from some of these benefit requirements in the ACA. Keep in mind also, this is just the first act. It goes to the Senate next, and it could get improved there. And I would imagine that that score from CBO will be particularly important in the Senate.
You mentioned reduced premiums, but who do those premiums get reduced for? Because you also have these high-risk pools where they may not be seeing that same premium cost.
Right. Well, remember, there's a lot of misinformation about this provision on high-risk pools. It would be a very limited number of people. First of all, under this legislation, if you do the right thing, if you buy and keep coverage, you don't have to worry about any of this. You'll be able to get coverage at standard rates and change plans. And by the way, that was true in the market for employer coverage 15 years before the ACA came along. So it's really, how do you deal with people who do the wrong thing, who wait until they're sick to buy coverage, which you just can't have everybody do that or the market won't work. So that's what they're setting those pools up for. It's probably going to be a very small number of people, and that's what that last amendment was about, was to make sure that it was funded.
So you say a small number of people. The 24 million people that was first referenced, this first incarnation of the bill that would be without insurance, who are those? That's not that group? You're talking about a smaller number from that?
Yeah, no, I'm talking about, remember, just because you don't have insurance doesn't mean you have a medical condition and vice versa. When you talk about the 24 million, that was a CBO estimate. CBO has been wrong about this. In fact, the former director, Doug Elmendorf, at a presentation at MIT a few weeks back, was talking about how they got it wrong when they originally passed this bill. CBO has tended to overestimate the number of people that would go into the exchange, and they've underestimated the number of people in Medicaid. So I wouldn't put too much on that number of 24 million uninsured.